Oh, fine. Good morning, everyone. Welcome to the Rhodes Monthly Checkpoint with the focus on EDI. And it is, as it states, November 2025. Holidays are just around the corner. Okay, we have a very nice agenda. Thank you, Kelly. We're going to talk about a lot of things. We are going to review the agenda. Meet the team is always a quick one for everybody who is new or doesn't know everybody. There's recently not that many changes, so that's the good news because it's nice to meet new people, but if you're working with a team, it's nice to get to know each other. There's a page about owls and all kinds of information you can find on out there. We're going to talk about objectives, and Rhodes version 2 is live. Jody will tell you all about that because, as most of you know, we have the nickname of the EDI webinar named the Jody Kramer Show. So she'll be talking a lot of times. And once in a while, I'll hope to take over so she can take a little break. Talking about EDI documentation and an update for MCICS MRSS. The MFT transition from the SFTP, the burn providers, there's a lot of things changing there. And with the V2, a lot of things are coming. And where and who and what to report. The BHRN, burn as we call it. And then we have one more with Jody's name on it about file error visibility and monitoring decertification policy. That is quite a mouthful. And the comfort check and question time. And then the microphone is in my hands again. And we'll always end up with the Q&A and some contact information for everybody who would like to find out who we are and how to get in touch with us. Okay, so meet the team. Who is the team these days? As you can see, Kayla, who is on a wonderful vacation in Italy. I hope it is. So she won't be here today, and she won't be here for this week and next week. So you have to deal with myself or Mary, our support specialist, or Cecilia. There are the kind of like the front office for our customers that if you have a question or you have something you want to try to find out, you'll probably run into one of those, and they're very helpful, and hopefully they can help you. And if not, they usually know who to talk to or to point you to the person who should know most about that. And of course, Justin, our report specialist slash research analyst, knows everything about reports. And if there's anything you would like to get more information about from the system, he's your guy. Or Anna, she's also a Anna Melcher, report specialist and data analyst. And then, of course, we have Kelly, who made this wonderful presentation and is always our specialist in any form of communications, doing a great job. Thank you, Kelly. And Lisa, our junior system admin, who just came back from vacation, so she's well rested and can pick up the slack that Kayla might be leaving a little bit. And of course, everybody knows JD, our EDI technical expert. Okay, and the next slide is on the scale of medieval owls. How are you feeling today? That is a good one, Kelly. I did not see that one coming. I was thinking of the OWL, which is our SharePoint site where we get all kinds of information. So they're
just keeping you on your toes.
Thank you. Medieval, that always has a bit of a sound that sounds a bit dark to me. And they were called the Dark Ages. So, and I see a lot of votes going up for number 6. Uh-oh. And there's an arrow going towards it. And number 8, I like the kind of surprised look on number 8, but maybe that's just me. Number 6, another one. I see a lot of them. 7. That looks nice and fluffy. I like that one too. And the number 2 and 5. 2 is also just getting out of bed, I think, and has not used a comb or anything. Yeah, a lot more 2s. I can relate to that one, especially this early in the morning, and the weather is with a lot of liquid sunshine here, of course. So, yep, yeah, I like them. Thank you, Kelly. Okay, what are we going to do today? What do we usually talk about in this webinar? And we'd like to give you any information about any changes, enhancements, updates, anything new, things are coming up. We'd like to talk about data issues. If we notice certain information is coming in that gives a certain idea about how things are going within the Oregon behavioral health treatment world, maybe we get your input on it, get your feedback, get information about how we can make things better. And that's also one of the objectives that we have. Future webinar topics. If there's something that you and within your organization notice that you would like to know more about, find out things that maybe are helpful to you or other behavior treatment facilities do certain things a certain way, then maybe it can be helpful for other ones as well. So, and hopefully any questions that you might have, I hope we can answer them. And if not, we'll definitely find our specialists or people on the program side that might have the answer and get back to you as soon as we can. Okay, and the next one is about Roads V2 is live, and that was Jody. My memory serves me well.
Yes, I think it is me.
Go ahead, Jody.
Awesome. Good, good. Can you hear me okay, Pete?
Yes, you sound good.
Okay. Um, Great. So yeah, very exciting news. Of course, you all got the documents back in July, got a revised ones there in October. But we did the V2 release is live now in our production environment. This happened on about a week ago Monday. So last week we did this, and it kind of brought up a couple things I wanted to go over as we have been working with EHRs and stuff on this development. That there's kind of some priorities and different considerations. So what I mean by that is, we have been working, it's on the bottom slide, bottom bullet here, but we've been working with a number of EHRs um, consistently. So Dr. Cloud, Ocean, Credible, CareLogic, ReliaTrax have all been actively working. We've noticed that there's been a lot of questions, a lot of emails, a lot of meetings. We've met with them a number of times. We have standing calls with some of them once or twice a week. So I guess the reason I'm saying that is that if you have, if there's other EHRs on here, or if you have an internal team that is working on your roads version 2, um, it still is a significant lift. There's 330 plus data elements that one of the HRs was so kind to put in one of their presentations. So it isn't a light update. I mean, the structure stayed the same of the file, but we added more elements, obviously, of data. We added more segments, which are combinations of those elements that are allowed. So there is a pretty good lift on this. So we want, because we've heard back from a few EHRs that like, well, we can be, we can have this done in like, 1 quarter and they'll be fully live. And that might be the case, but we really encourage folks to get with your EHRs, uh, get with whoever's going to be doing this work for you, and make sure that they're, taking the time to go through the 2 documents that are companion documents we sent out, because um, it will give a deeper understanding. I mean, we had one EHR that even told us, oh, well, we thought Oregon was a simple state. And like, no, we're usually on the cutting edge, um, as I would like to call it. So, and part of these complexities have been around. We now have burn that's going to be reported into the road system. And burn episodes of care and standard episodes of care are slightly different. There is a unique structure this that includes many episodes of care underneath the burn episode umbrella. Um, if you're in burn SUD episode of care, you can't be in a standard SUD episode of care. So just a lot of different dependencies there. Um, Also, we have these things called service elements, and for some of you, service elements and CFAA kind of go not exactly together totally, but they're dependent in some ways. We're finding this is a very complex situation. We are working with our teams here at OHA to get some flow charts to help clarify, like, because some folks are like, well, we're a CFAA, so we don't have to report service elements. Well, we're hearing that may or may not be the case. So there's a lot of different pieces here. And the CFAA and the service elements have some tie into the funding, okay, of like what's funding this episode of care for a person. And so I think one of the big takeaways here, too, that I didn't put a bullet for is that when we say it's a significant lift, it's really how the workflow is going to, I think sometimes it's more the UI UX, like the pages, the place within your flow of your EHR. Where is it going to be collected? How is it going to be collected? What are the clinicians going to have to be putting in around some of these things like service elements or CFAA? Or, is it possible that you're developing something that's automated tying to your billing, the funding that will fill that in? So, the slide's not to scare everybody because we are excited that it's live and we are, really looking forward to getting the additional data, but just wanted like to go out that like this is a significant lift. There are some time dependencies around part of this, um, like burn, for example. Um, you Our leadership is given until November of 2026, November 1 of 2026, so about a year. But to be fully up and compliant with burn reporting via EDI, we've heard from a number of the EHRs we're working with that they will be meeting that well ahead of time. But if you're meeting with your EHR, or like they're not going to build burn out for you for some reason, right? Then if that's going to happen, like then we're going to need to pivot you to the portal. And we can have mixed data submissions, so you can submit burn via the portal, which means you'll put it in by hand. So there's just a lot going on right now. We have Pete back and forth with myself, helping the EDI providers and the EHRs, and Mary Hurley, and of course Katie Solenberger, our roads operations manager. Like we've all been really getting ourselves available for this so that we can make sure that everybody has the time um, and attention that they need. So if you're not one of the ones on the bottom and you want to get on our calendars and make sure that we can meet timelines, reach out to myself and or road support. They'll get you routed to me, and we will make sure that we've got ourselves load balanced to help all of you. So I think, Pete, maybe the next one's mine. I'm not sure. um
It's the Jody show from here on out.
Oh Lord. Okay. Well, I'll try and like what do they say? Do your voice is is like a song. Change it up, louder, softer, whatever. So hopefully you guys are not like, oh man, I gotta wash my ears out. Um, so the EDI documentation did leave the building and a revision left on October 3rd. There will probably be an additional one that comes out at some point. It does not have significant changes whatsoever. There's just a few um, little nuances that just we need to, some extra stuff on like the business. More clarity is really what it is. As we've met with the some of the EHRs, we're finding that, there's a few things we need to add in there. So most of you should have the documentation. If you're an EHR on here or a provider and you're not sure, get back with us. We try to keep our list up to date. Um, most of the EHRs that we're collaborating with actively did confirm they've received the ones from October 3rd. Um, and, everything you need to support the new structure should be in those two documents along with all of us. And we are appreciating the constructive feedback and comments, and we will be working to develop some additional like workflows and just some more, maybe adds more to our reference manual, just as we've heard that more information might be helpful or more clarity around some things. So again, if you haven't seen it, let me know, or road support or us, let us know. So if you want to move to the next one, Kelly. Okay, so update for mobile crisis. You know, we have this left on here, and basically mobile crisis and MRSS. I was thinking for a second. So temporarily, most of you probably already have this information, but we just wanted to reiterate that the quarterly reporting that had been going to OHSU has now been coming to the Compass team here, and our team is, curating that, and then we are getting that data back up to OHSU for some additional aspects that they do with it. So through the rest of this year, keep submitting to the Compass support. And I was hoping we'd have more information, but I would suspect that unofficially that this will probably roll into Q1 of 2026. So be on the lookout for some announcements around this. We think everybody is there and has gotten it, but I know we're getting close to the end of the year, and so some of you might be like, well, what's going to happen in January? So we will have more information on dates, but it would be my suspicion that you will continue to send those into quarter 1, for sure. So because this is also dependent on your EHRs and the development building out your version 2, because once you have your EDI version 2, then we'll be collecting a lot of this data in roads. So, okay, let's move on to the next one, Kelly. Okay, this one's more of like a congrats. So MFT transition update. The update is you all did phenomenal, and I mean it. Like, our teams in OIS has said our transition was one of the smoothest they've seen, cutting from one old legacy uh, place to put your files to the new one. So I just wanted to say thank you, thank you. I appreciate all of you who pay attention to the emails when they come in. We try to send them to you only when they're important. So, again, thanks. If you are like, what is MFT? And I have no clue what this is, that's okay. Um, get a hold of us, send something to road support or myself. But basically, it's more secure, it has more reliable data transfers. Um, because even the auto EHRs, like all of that went really smooth too. We worked with them, and yeah, it was great. What I will say, one of the biggest things that's exciting is the passwords change every 180 days, and there's no lockouts. So like if you try to log in 3 or 4 times incorrectly, it doesn't lock the account up. So should be a much smoother process for us, even when we run into hiccups. Now, I know I've gotten a couple emails from a few of you of recent, maybe 2, that I needed that I'm following up on. But all in all, this was a great success. And I just, again, want to say thank you. All right, next one, Kelly, unless we got questions. Okay. Yeah.
No,
Yeah, the
to
180 days.
give you a break, Jody. There's some
You want to
chat
do
going.
this?
No, no, no. There's
Oh,
some. I just thought I'd give you a break and talk about the chat that's
sure.
going on. There's
Awesome.
some going back and forth about questions and sending emails directly to us, and that's fine. But do keep in mind that we sometimes get a lot of emails. So the roads help desk email is the main one. That's where we monitor everything coming in. There's multiple people monitoring it because sometimes we have other appointments. Doctor's appointments are in or out half a day or not in a day. And then the the help desk will definitely read your stuff. There's always somebody there monitoring it and make sure that it gets into the right place, because sometimes some of the emails kind of fall through the cracks, and you might have sent it to us and we thought it was something else and we might have missed it. So please send it to not just us, but definitely to the roads, and we'll get to that contact information at the end as one of the later slides. So go ahead, Jody.
Okay. Yeah, I will say that. I know we've been inundated with stuff and trying to parse through all of it. So I do apologize if there has been not as quick of a response as I would normally do, but we were really pushing to get that release out so that you guys can actually test your V2 and submit. So things will be smoothing. The road will be smoothing out somewhat. So burn providers. Behavioral Health Resource Network used to be Measure 110. Burn is now available in the portal for manual entry. And of course, EDI can be sent that way. When this says burn training sessions will begin, these are training sessions for portal entry users only. EDI providers do not need to attend these burn trainings. Your burn stuff is going to be coming in with your EDI submissions. So unless your EHR tells you differently. Um, again, specific training will be rolled out to different agencies. Most of you, this is not going to apply to. Um, all the information you need to know about roads reporting. If you do want to attend one of them, by all means, you can sit in on one and get information. You can obviously, as an EDI submitter, you will be able to see your burn submissions in the portal through your login in a read-only format. So um, you'll still have some resources there if you do get into the portal, or if you're like, hey, I just want to take this training, that's super. If your organization is already reporting to roads, you do not need to fill out an access agreement. So what that means is probably all of you on here who are already sending stuff in through EDI. I know there's been a lot of communications coming from program staff, part of our business analyst side of our team. And, it's like get registered, do this, do that for burn, and actually we don't need to create access agreements for all of you because we already have an active one on file. So no worries there. So pretty much if your EDI and your EHR is developing burn, you're good. You're kind of good to sit in a pattern until their development and deployment is done. And I would encourage any of you that are with some of these, if you're wanting to be a beta user. I mean, it takes some time, away from your regular stuff, but it's also good to kind of be in that, pocket of helping develop it and test and not develop it. You're giving feedback, you're getting more input, I think, from what I've seen. Okay, next slide, Kelly. So where to report burn data? Because there's been some confusion around this. So there's two lanes of traffic for burn data. We were meeting with one of the providers, and they were like, wow, this quarterly report that we used to do, it's lighter than it used to be a little bit, like there's not as much there. And I was like, well, that's because the quarterly report is going into submittable. Okay, it's like aggregate data, program data, it's your counts, it's expenditures, it's narratives, it's summaries, okay? But the piece that looks lighter here is in the opposite lane that forked off and went over here to roads, which is going to be the client level data, which is like screenings, SUD services, peer support, housing. So all of those things that maybe look like they're missing or certain things are a little more light on the quarterly report are going to be able to be obtained from over here where the client level data will be living in roads and where our analytics teams will be able to access that data. So if there's any confusion on this, which is completely understandable. Again, roads support. We will, the roads inbox, we will help get you navigated out. I know Kayla Camilli and Lisa and a few are doing a lot of work around the burn stuff and getting things, you know, figured out for what we need to do to support. So reach out to us if you're confused. If you have to, old school, try the phone number. For our phone numbers, that works. I know a few of you just called me direct, which is good. I'm always open to the phone call. Okay, how about next slide? You guys have seen this slide, I think, for a time or two now. And basically, the biggest takeaways we want to let you know is that with the new road system, we have a really nice administrative dashboard and access point to the system where we can see pretty much everything almost in real time. And so your file errors, the visibility and monitoring for that, and especially now that we're beyond a couple of big milestones, is able to be done by just about anybody on our team that has access to the roads administrative portal. Okay. And just what that means is like we're just trying to keep an eye on things to make sure that, if we see some files that are failing or we see some files that are erroring out with a huge um, error rate, we're trying to get a hold of for those providers and trying to, talk with them. We always want to be proactive versus reactive if possible, because we really don't want to hit any type of decertification if we don't have to. So, what is decertification? Well, it just means that you, as the provider, even if it's your EHR, will be just decertified temporarily until we can get the issues cleaned up. And the decertification really, when it says temporary, I see Thomas's thing popped up. What it is it's really a case by case situation. So, if we see that there's 50% error rate or higher, if we see files getting submitted over and over and over again with the exact same data every single day, like your full book of business every single day, we might reach out to you because that's a little bit of a overtaxing of the system that may not necessarily be appropriate. Um, submitting incomplete or invalid data. Like if we look at it and we dig into your file, it's like, oh my goodness, all of a sudden, like you're missing, say diagnosis, for example. Like, if you're missing a whole bunch of stuff and it kind of just happened, sometimes there's changes that may have gone on and folks didn't know about it. And so we just bring it to your attention and we just work with you to correct it. So decertification is the absolute last resort. We want collaboration. But of course, data quality is the primary concern. So there's nothing huge on the horizon right now. But just be aware and just be mindful of this. And the biggest thing is if you think you have an issue, let us know. Like it's always better if if you're calling us going, I don't know, we might need to talk about something, because then if compliance or anybody else does, or your program people that you work with here have any questions, then it's always better if it's like, oh hey, yeah, we know about that. We've been working with them and we can kind of give an update. But if we're in a reactive mode, we can still give that update, but it's just better if we can collaborate and just because we all want to reach the same end goal together. So, friendly reminder.
Definitely. Thank
Yeah.
you, Jody.
I
Yeah,
always
there
have a
was a
comfort
there
check
was
because I
there,
might be the third one over.
yeah, there was a question from Elaine about error monitoring has been neglected because we are knee deep in prepping for our new EHR. Is there something I can report to give us a break? Uh, you have to connect with us because error, error monitoring has been neglected depends on how your system has been working, because we know there are several systems that have a very high success rate. So if there's one or two errors in there, not a big deal. If you still have to work a lot on the stuff because there's no edits built in, or not all the edits are built into the system, So it's kind of like a frequent and somebody's job to kind of keep an eye on things. Then it might be a little more work. So it kind of depends on the situation, is what I'm trying to communicate here. So sorry, go ahead, Jody. Comfort
Oh,
check. Are you having a
yeah.
comfort check for yourself
Well,
or?
I don't know if you what I will say is if you are in the throes of an EHR change, which Elaine, we do know that your organization, we've been notified by you all and them. And so we kind of know there may be some wonkiness. That's a technical term. Anyways, uh, there may be some wonkiness, which is understandable because you got to divide, conquer and divide. So, um, Elaine, no worries. We know what you're doing. And again, for anybody else, yeah. Um, I don't know. My comfort check, I don't know if I'm squiggly eyed, but I'm somewhere right there, Pete.
True.
I need a little more caffeine. Anyways,
Okay.
all right.
Looking good.
Hopefully everybody else is feeling okay. Oops, what's this?
Yes, because it's definitely a check for you guys. Are we clear? Did we
Mm.
o- overshare something that kind of confused you? Because it sometimes happens that we try to help give you information about something that is going to happen, and we get people worried, like, what do you mean it's going to happen? Like the decertification. That's a strong term, and I don't think it has happened ever, but it's just like we kind of have to think about the data quality and the information coming in. So Lisa is sharing all kinds of information with everybody, so that
And
is good.
so there
There's
was a
a
question from Erin, which is the project manager for Ocean. So thank you for being here, Erin. Those flow sheets, we have not gotten a timeline. We have, labeled them as urgency with our business analyst and the program staff. And there's also another pocket of the behavioral health leadership that is working in tandem with that, especially under for the CFAA and the service element piece. So I hate to say I don't have a date, but I don't. But they do know that it's priority. Katie's been highly involved with that. So,
I saw a question from Liz.
Liz.
I'm new to this whole system. Is next week's training going to help me get started? I I I'm inclined to say no, because the training next week is definitely focused on burn, unless burn is the information you will be providing
Well,
to us.
I think next week is the welcome to Mott's.
Roads.
Lisa
Welcome to
Rhodes,
Roads.
excuse me. Yeah, Freudian slip. I don't know. Um,
We'll do it.
yeah,
Hey,
Lisa.
Jody.
Yeah.
Sure, I'm happy to speak to that. So anybody who is interested, even if you may be an EDI provider, if you are new to roads and would like to front load that information and just get an overview about how to navigate in the system, we always encourage people to join us to learn more. We've had EDI folks join those webinars previously. Kelly can attest to that as well. So please don't ever hesitate. The more that you experience or kind of learn in those sessions may prove to be helpful, may just give you some information about the system in general, but please always feel free to join us for any of those webinars.
And Lisa, if I remember right, that those webinars also have a beginning part that kind of talks about the why and the how and the some of the thought process behind roads, what it is, why we do it, and why it's important, right?
That is correct. That is absolutely correct.
So
And
yeah, I think
I
it's
just, sorry,
go
Jody, I
ahead.
was
No.
just going to say, I just popped a link to register for that in the chat. And it's always the second Wednesday of the month. So you can join us anytime.
Yeah, and I don't know if the intro to roads are recorded or saved anywhere, but
We don't typically post them to our website like we do these, but we send out a bunch of information and the deck afterwards to folks who've joined us. So there's a lot of resources and things. Um, so, but maybe we should start putting a few online as well if people want to check that out.
This is Lisa. I'm going to go ahead and drop the OHA roads page as well into the chat. So if there's any questions about webinars, there's FAQs, there's resources. I'm going to put that in the chat so everybody has the opportunity to kind of poke around on that page. Stand by just one moment. I'll get that in there.
Okay. So a couple things. First off, so Sean, your question, how do we know when we submit an error? So basically when you submit a file, there's a results file that gets sent back to you in your outbound folder after that processing point. So if it was 5 a.m. or 5 p.m., when the file's done being processed, you get that error report, and it will, within that error message results report, it will tell you how many transactions were successful and how many weren't. And the ones that weren't successful, it will tell you what was wrong with them. So say if you had 100 submitted and 10 had errors, you would get 10 with detailed results, and you would get the other 90 would say successful transactions. So that's where that's at. And, we're happy to, if you want to ping us with this, Mary and I, we can, meet with you or go over this and help you, show you where those are at. And there is the ability for folks who get your portal access for EDI, that you can see your submitted files and you can see your errors and drill down into your clients and stuff like that. So, Sean, I would say if that didn't completely answer it, reach out to the Rhodes inbox and we will get some time carved out to help you out. The other question I had, I see somebody posted in here training dates and registration links for Burn. And I think, Sydney, you're with the Burn team. Could you give a little insight into what this means for, other than like the obvious? Is this about how to collect or what to? I guess I'm wondering for folks on here, like what to expect from these trainings. Can you help us with that?
Hi, yes, I am from the Burn team. This is Sydney. No, I
Nice.
cannot tell you anything about what's coming. I received these links from the Rhodes team, so I
Yes.
would hope that you could tell me what's coming, if
Yeah.
possible.
Hi, this is Kelly from the
Okay.
Rhodes team. Yeah, those are actually our dates that she posted in the chat. And those have been shared out with providers. And yeah, we're starting those Burn portal. Those are the portal trainings where we'll do a walkthrough and show how to do various tasks in the portal. And those are beginning next week. And we have an alternating, we're doing a peer support and housing focus where we share how to input that data, and then a SUD and screening focus the other time. So we are busily working on that, but there will be a demo where we walk through and show folks how to do that. And then there'll be a hands-on time, a lab portion where they'll be able to do it themselves. So it's
Okay.
a really hands-on, and it'll be a good opportunity to ask questions and get support and kind of figure out how to
So,
navigate roads.
so these people would need to have their login to the portal and their credentials and MFA, correct?
Yes, correct. They would need MFA before that. And there is a thing when you go to register for those, it does prompt you and ask, do you have your MFA set up? And so people
Okay.
are supposed to reach out if they don't or if they have any questions.
Okay, awesome. I just wanted to make sure that folks here had just a little understanding on what that actually was, so that, because they probably unless you're just interested in learning it, or seeing how we've set it up. Maybe you don't have login, but you want to join the training because you want to see, well, what does their, stuff look like? How is it laid out? Blah, blah, blah. Like, then definitely you could register and attend. I just wanted to set the expectations.
Hey, Jody, it looks like
Uh,
Elaine had her hand up first
For a
for a
while, yeah.
question. Yeah.
Okay, super.
Hello, quick question. Is there any plan that you guys have to automate the corrections that we send in? So I know that admit date changes, last name at birth changes. I think there's one more, but it's escaping my brain. Those all have to be on a spreadsheet and emailed in. And I was wondering, is there a plan to automate that, or is there an ability in the
Yes.
portal to correct that?
Currently, there isn't the ability to correct it in the portal. This is something, those are key, not necessarily the admit date, but the last name at birth and date of birth, are key anchors in the system for a person across the entire road system, regardless of which agency they're with. So those things have to be done and or authorized by our teams. Somebody at, Cecilia or Mary are typically doing those. What we have that is on the horizon is the ability for you to submit those within the portal, where you can, I don't know exactly how it's going to look or feel, but there will be the ability to request those to be changed within the portal, and then an ability for us to, like, approve it or whatever we do. It'll like notify us, right? And then we'll say yay, nay, what uh needs more research, whatever. But yes, there definitely is. And that's the cool thing about the platform now that we're on, is that so much of this is able to be done within the system. And so we had to, of course, scale back all of our shiny stuff to go live to get us up and running. But those are definitely what we call user stories and features that are in our queue. So yes, more to come on that. We feel the folks doing them also are excited to have more of this automated.
This is Mary, and
Hi, Mary.
I especially would appreciate the automation coming in. Elaine, I usually do the corrections. It's taking me a little bit extra time to do them than I was in MOTS. So if you have some correction requests that are in, just please be patient. I'm working
Oh,
as fast as I can.
Mary, it is so not a commentary on what you do. I'm basically in the throes of documenting workflows for every little teeny weeny thing we've ever done in our entire lives across the agency. And one of my responsibilities is documenting that. And so I was just trying to see kind of, okay, is that a future flow? Is that a work wish list? I know these terms mean nothing to you, but I am so insanely busy trying to document everything for the new EHR that I just thought I would ask that if maybe, that was going to be an option in the future. Totally not even a commentary on what you do. So please don't digest it that way. I just was wondering, hey, when I'm writing this, can I say future flow may include work in the portal? That was totally all I was saying.
Yeah.
Uh, no, no harm. Just it's this is new. It's new for me, so I'm getting used to the workflow too. Okay.
Thanks,
I think
Emily. Jessica has her
Jody.
hand up for a while. Or did Jody
Yeah.
want to comment something? Go ahead,
No, I'm good.
Jessica.
Good morning. I'm back on the burn subject because what's been happening right now is we, my CFO reports, I think you were calling it submittable. He does a spreadsheet on a quarterly basis. I handle the roads or MOTS form that's submitted to roads for clients who may have been referred via the burn track, but have actually entered one of our SUD programs. Until November of 2026, which is the most recent communication that I have from OHA, acknowledging that roads will be handling much of the burn reporting, but has punted out till November of 26 to help get the whole system put in place. Go up until November of 2026. Do Scott and I just continue to handle this exactly the way we have been?
So, and the only reason we punted it out, just for clarity, is to make it easier on the rest of you and your EHRs, because there was talk about making you all enter it manually on November 1st of 2025. And that was like, oh my gosh. So we've pushed it a year so we can work with the EHRs and whatnot. And I would say, yes, in the meantime, just keep submitting your, the system's actually called submittable, if you're not, anyways. So I would keep sending the quarterly report to the new submittable system. And then, I'm sure you'll be plugged in with CareLogic. Jessica, you're always um, out there making sure you're on top of things. So, um, yeah, I think you just kind of sit in that pattern until CareLogic has this built.
Okay, so I don't need to worry right now about attending
No.
any of the portal sessions for burn submissions if Scott and I continue to do it exactly the way we've been doing it.
That would be my opinion.
Okay, thank you.
Yes. Mhm. That's
Hey,
why I was
Jody,
kind of
this is
asking, like, what are those trainings, right? Because I didn't want all of you to think, oh, goodness, I got to go to all of those if, you don't need to.
sorry, Jody. This is Lisa. Colette had a question in the chat. It says, will we be notified if our EHR is choosing not to support burn EDI reporting?
You all probably should be checking with your EHR. I do know that the EHR you have, which is credible, is building out burn, Colette, and I believe CareLogic is, and I know Ocean is, um, and I believe Dr. Cloud. We're still in the early connects with them, but I do know for sure that those other three are.
Yeah, I think
It looks like
didn't Lisa put out a list in the chat a little
I
earlier?
did. I can also drop it because sometimes it gets buried in the chat. I'll repaste it to the chat. We also have a next question or comment from Cindy. Hi, Cindy. I'm curious if there's a way to get connected with other clinic directors, managers, etc., using Roads, EDI, OCHIN to learn best practices and processes for how those clinics are creating systems to have therapists regularly update Roads, i.e., actively getting updates from clients every 90 days. If folks out there have great practices, please connect with me. And Cindy was kind enough to put her email in the chat. So if anybody would like to connect with Cindy to discuss best practices, she is making herself available. Thanks, Cindy.
Thank you.
Yep. Also, Anna um, asked if there will be an update to the roads portal like we had before for sending what we called certification files, which were files that either A, you were doing sending and checking during certification, or as an ongoing process to scrub your files. And yes, we are looking to have this in one of our minor releases. We got the major release done here a little over a week ago. We've got a couple minor releases. I'm not sure exactly where it is landed, if it's in minor release 1 or 2, but I, I'm I'll try and get back to you with a date. If you don't hear something, ping me. But it'll either be around the first of the year or it will be um like around March. So it'll be one of those two dates because we do know that we want it in as soon as possible, because for those of you certifying your EDI V2, we want to make sure that that's available. Okay.
Thank you, Jody.
Mhm.
I think we're getting towards the end of it. There was a question about recording. I apologize. I usually open with that these webinars are always recorded and always placed on our website. So if you missed a piece or you want to go through something one or two more times or share it with your coworkers or within your organization, they should always be on our website. So I have a quick question to Kelly, because I'm looking at the presentation and I see 13 of 17. Does that mean we still have 4 more to go,
Oh,
or were there a couple of
no,
hidden ones that we
there's a couple
skipped?
hidden ones that
There you go. That's the
we were
trick.
not sharing, but yeah, we there's
Okay.
no surprises.
Thank
Oh,
you.
thank goodness. I was like, I don't know what I missed, but
Same here. All of a sudden it was Q&A and it's kind of like, what? But anyway, thank you, Kelly. And thanks, everyone. I think we're getting to that time that it's, yep, getting close to the end and we should everybody let go. So let's stay in touch. Questions, comments. We are always available, open for business whenever you have any issues. Roads at odhsoha.oregon.gov. And for EDI specifics, you can always send Jody or myself information, questions. But the roads one is the most secure one because it'll end up on both our desks usually, because we have our daily review where we see what all is coming in into the mailbox and kind of divvy it up like whose task is what. And a lot of the EDI stuff is kind of pushed to Jody and myself. So there's always one of us that will definitely pick up on that. So, okay. And I think that's it. And I see a lot of thank you. Thank you, everyone. Thank you for joining. Thank you for participating. And we'll do it again next month and have a wonderful rest of your day. Thank you very much.
Thanks, everyone.